Have you ever noticed that no matter what you do, no matter how many times you clear your throat throughout the day, that thick, uncomfortable feeling in your throat just keeps coming back? That sticky sensation like something is permanently lodged in there that never quite goes away. You clear it in the morning and it is back by lunchtime. You clear it before a conversation and it is back within minutes. You have tried warm drinks, honey, lozenges, over-the-counter syrups, and nothing seems to make a lasting difference. And perhaps the most frustrating part is that when you mention it to people, the response is almost always the same. Oh, that is just mucus. It is normal at your age. Do not worry about it. I am here today to tell you something completely different. That persistent mucus in your throat is not something you have to accept as a normal part of getting older. It has a cause. And once you understand the real cause, the solution becomes far clearer and far more accessible than most people ever realize. I am Dr. William Lee, and in 15 years of clinical practice, I have sat across from hundreds of patients who are told the same thing you have probably been told, that this is just what aging feels like. That the throat clearing, the sticky sensation, the constant discomfort, these are simply the price of getting older, and the appropriate response is to manage them quietly and indefinitely. I want to tell you clearly and directly that framing is wrong, and the cost of believing it is months or years of unnecessary discomfort while the actual cause goes completely unaddressed. Today we are going to talk about what is actually causing your persistent throat mucus at a deeper level than most explanations ever reach. 4 specific causes that most people, and honestly even many healthcare providers, consistently overlook. And a practical step-by-step plan you can begin implementing today, not next month, not after another doctor's appointment, today. Before we go further, I want you to drop a comment below right now. Tell me honestly, how long have you been dealing with persistent mucus or the constant need to clear your throat? Just roughly, how long? I read every single comment personally, and your answer genuinely matters today. And if you have ever been told it is just your age and to simply accept it, please add the word dismissed to your comment. I want to know exactly how many people watching this have been given that unhelpful response, because I suspect the number is going to be significant. Now, before I get into the 4 causes, I need to give you a piece of context that most people have never heard explained clearly, because understanding this one thing changes how you think about everything else I am about to say. Mucus is not the enemy. I want you to genuinely hear that. Mucus is one of your body's most sophisticated and most important defense systems. Every single day, your body produces it continuously, and it does so for very good reasons. Mucus traps dust, bacteria, viruses, and airborne particles before they can penetrate deeper into your airways. It keeps the delicate lining of your respiratory passages moist and protected. It is the immune system's first line of defense, working silently every hour of every day. The problem is never the mucus itself. The problem begins when that normally fluid and manageable protective layer becomes thick, sticky, and difficult to move. When instead of flowing smoothly through your system and being cleared naturally, it stagnates, accumulates, and creates that persistent, uncomfortable sensation that sends you reaching for water or clearing your throat dozens of times a day. And here is what makes this significantly worse after 60, and why understanding this context is essential before we get into causes. As we age, the muscles involved in swallowing become gradually less efficient. The lymphatic system, responsible for draining excess fluid and preventing tissue congestion, operates at a reduced capacity compared to earlier decades. The tiny hair-like structures lining your airways, whose job is to sweep mucus upward and outward, work more slowly, and any irritant that enters the system tends to linger far longer rather than being cleared quickly and silently the way it once was. This means that factors which might have caused only a brief, barely noticeable mucus response at 40 can cause a persistent and genuinely disruptive response at 65 or 70. The biology has changed, the sensitivity has increased, and the remedies that might have worked a decade ago may no longer be sufficient. I want to tell you about a patient named Evelyn, 68 years old, wonderfully determined woman who came to see me after 8 months of what she described as a throat that never felt clear. She had tried everything she could think of: honey and lemon every morning, steam inhalation before bed, various preparations from the pharmacy. Nothing produced lasting relief. 2 different people had told her this was simply the kind of thing that happens as you get older. When Evelyn and I sat down together and went carefully through her complete picture, her daily habits, her medications, her sleep position, her meal timing, what emerged was not one cause, but 3 overlapping factors, none of which had ever been properly identified, none of which had ever been addressed. 3 weeks after we tackled those factors with the approach I am going to share with you today, Evelyn sent me a message. She had woken up 2 mornings in a row without that feeling in her throat. For the first time in 8 months, no prescription, no procedure, the right information and the right practical steps applied consistently. That is exactly what today is about. Cause 1, silent reflux. The first and most consistently overlooked cause of persistent throat mucus is something called silent reflux, and I call it the great impersonator because it produces symptoms that feel like a dozen different problems while hiding its true identity almost completely. Most people are familiar with classic acid reflux, that burning sensation in the chest after a heavy meal or strong coffee. Many have experienced it, but silent reflux is different in one critically important way. With silent reflux, stomach acid travels upward not just into the lower esophagus, but all the way up to the throat, the voice box, and sometimes even higher. And because the throat and vocal cords are far more sensitive to acid than the esophagus is, even microscopic amounts of acid reaching these areas causes significant irritation and inflammation. Here is what makes it so consistently missed, and why so many people live with it for years without identifying it. There is often no heartburn, no burning sensation in the chest, no obvious digestive discomfort whatsoever, just a persistent need to clear the throat, particularly in the morning, a slight roughness or change in the voice, sometimes a mild sensation of something being caught in the throat, and that mucus that keeps returning no matter what you do. What is actually happening is that your throat, sensing the microscopic irritation from acid contact, produces extra mucus as a protective response. Your body is trying to coat and shield the irritated tissue. This is a completely logical, appropriate biological response. The problem is that when the underlying acid exposure keeps occurring night after night, the protective mucus response keeps being triggered night after night. And no amount of throat clearing, honey drinks, or lozenges addresses the root cause, because the root cause is acid reaching your throat while you sleep. Ask yourself these questions honestly. Does your throat feel noticeably worse in the morning than it does by afternoon? Do you notice more throat clearing when you bend forward or lie down? Does your voice sometimes sound rougher or different first thing in the morning? These are not random symptoms. These are a recognizable pattern, and that pattern points directly towards silent reflux. The practical approach begins with 2 changes that are simple to implement and genuinely effective. First, stop eating within 3 hours of going to bed. When your stomach is still actively digesting a meal and you lie down flat, the physical position alone makes it dramatically easier for stomach contents to travel upward. 3 hours of upright digestion time before lying down is not an arbitrary recommendation. It is the amount of time most stomachs need to move a meal through to the point where lying down no longer creates significant reflux risk. Second, elevate the head of your bed. Not by adding an extra pillow, which only bends your neck and creates no meaningful protection, but by actually raising the head end of the bed several centimeters using a small wooden wedge placed under the legs of the headboard. This gentle, consistent incline uses gravity as a passive, continuous defense against stomach contents traveling upward overnight while you sleep. If you take any anti-inflammatory medication regularly for joint pain, arthritis, or other chronic discomfort, please discuss this specifically with your doctor in relation to your throat symptoms. Certain commonly used anti-inflammatory medications can relax the muscular valve separating the stomach from the esophagus and can reduce the stomach's natural protective lining simultaneously. Both effects contribute directly to silent reflux in people who have been taking these medications for years without ever connecting them to their throat symptoms. The connection is real, it is medically recognized, and it is worth having that conversation. Cause 2. Chronic sinus congestion and postnasal drip. Cause 2 is one that most people with persistent throat mucus are living with without ever identifying, because it does not always look the way people expect sinus problems to look. Most people picture sinus problems as dramatic: intense pressure headaches, severe blocked breathing, facial pain that stops you in your tracks. And when they do not have those severe symptoms, They rule sinuses out entirely. But chronic low-grade sinus inflammation in older adults often produces none of those dramatic signals. Instead, it simply produces a steady, quiet drainage of excess mucus down the back of the throat, particularly when lying down at night and during the early morning hours after waking. Here is exactly what is happening. You go to bed. While you sleep, your mildly inflamed sinuses, producing slightly more mucus than they should, drain slowly downward by gravity into the back of your throat. You wake up with that thick, uncomfortable feeling, the immediate need to clear your throat before you can manage your first sip of tea, and a voice that sounds rougher and more congested than it will be by midday. By mid-morning, gravity has shifted. You have been upright. The drainage has slowed. The throat feels somewhat clearer. And so the pattern goes, every single morning, while the underlying sinus inflammation that is driving it remains completely unaddressed. Many people experiencing this have been purchasing antihistamine tablets from the pharmacy for months, assuming they have ongoing seasonal allergies. And here is the important thing to understand about that approach. Antihistamines dry out mucus temporarily. They do not address the underlying inflammation. And dried, thickened mucus that is harder to move is often more uncomfortable than the original problem. You are not solving anything. You are changing the texture of the symptom. The genuinely effective approach for this cause is regular nasal rinsing with warm saline solution. A simple mixture of warm, previously boiled water with a small amount of plain salt used to gently flush each nostril once or twice daily. This washes away inflammatory irritants and allergens directly. It reduces the congestion driving the postnasal drip. And it keeps the mucus thin enough to be cleared naturally rather than accumulating in the throat. I understand this sounds almost insultingly simple given how long some people have been dealing with this problem, but the consistency with which regular nasal rinsing produces real, measurable improvement in people who apply it genuinely surprises most patients who try it. Tell me in the comments right now, have you ever tried nasal rinsing? And if so, did you notice any improvement in your throat? I want to know because your experience might encourage someone else watching who has been hesitant to try something that sounds unfamiliar. Always use water that has been boiled and cooled to a comfortable warm temperature rather than straight tap water. Tap water in many areas contains trace microorganisms that are completely harmless when swallowed but should not be introduced directly into the nasal passages. Boiled and cooled water eliminates this concern entirely. And add a very small pinch of bicarbonate of soda alongside the salt in your rinsing solution. Bicarbonate neutralizes acidity in the nasal passages and supports the thinning of mucus more effectively than salt alone. 2 ingredients, 1 simple daily habit, often more effective than months of antihistamines. Cause 3, medication. Side effects. Cause 3 is the one that consistently produces the most surprised reactions when I raise it in my consultations. And yet, once you understand the mechanism, the connection is completely logical. Certain medications that many older adults take regularly can contribute directly to persistent throat mucus, either by promoting acid reflux, by drying mucus and making it thicker and stickier, or by triggering a specific reflex that increases mucus production as a recognized side effect. Here is the piece I want you to pay close attention to. There is a category of medications commonly prescribed for blood pressure management. Some people taking medications in this category develop a persistent dry throat clearing sensation and increase mucus production as a documented, recognized, medically acknowledged side effect. This is not a rare or unusual reaction. It is common enough to be listed in the prescribing information. The mechanism involves a naturally occurring substance in the body that these medications allow to accumulate. In some people, that accumulation triggers an irritation response in the throat, a response that feels remarkably similar to having excess mucus because the body's response to that irritation is to produce protective mucus. If you take blood pressure medication, and if your persistent throat mucus began or noticeably worsened around the time you started that medication, this connection is absolutely worth raising with your prescribing doctor. There may be medications in a different category that manage your blood pressure equally effectively without this particular side effect. I want to be completely clear. Never stop or change any prescribed medication on your own. That is not what I am suggesting What I am saying is that this connection is real, it is medically recognized, and it is a conversation your doctor may never have initiated with you, but one that you are now informed enough to initiate yourself. If this is opening up new possibilities for understanding what has been happening in your throat, please hit the like button right now. It genuinely helps me reach more people who need this information. And if you are not yet subscribed, please subscribe and hit the notification bell so you never miss these conversations. Cause 4. Environmental irritants combined with dehydration. Cause 4 involves two factors that most people consider separately, but that in practice almost always work together, and whose combined effect on throat mucus is far greater than either one produces alone. The environmental piece first. Air containing tobacco smoke, whether from your own smoking or from regular passive exposure, damages the tiny hair-like structures lining your airways. These structures, called cilia, are responsible for sweeping mucus upward and outward so it can be cleared naturally. When they are damaged, mucus accumulates instead of being cleared. Even if you stopped smoking years ago, the recovery of these structures is gradual and incomplete in many people. But tobacco smoke is not the only culprit. Wood smoke from fires, strong cleaning product fumes used in enclosed spaces, heavy traffic pollution breathed regularly, dry heated or aggressively air-conditioned indoor air. All of these create ongoing low-level irritation that triggers continuous mucus production as a protective response, day after day, invisibly, without any acute episode that would make you identify the cause. Now here is where dehydration enters the picture and dramatically amplifies everything. When your body is not adequately hydrated, the mucus it produces becomes noticeably thicker and stickier. Think of the difference between honey at room temperature and honey that has been chilled. The composition is identical. The consistency is completely different. Your mucus behaves in exactly the same way. Well-hydrated mucus is fluid and clears naturally. Dehydrated mucus is thick, sticky, and accumulates in the throat rather than moving through. And here is the aging-specific issue that makes this particularly important for adults over 60. The thirst mechanism becomes less reliable and less sensitive as we age. You can be meaningfully dehydrated enough for your mucus consistency to be significantly affected, and feel no particular thirst whatsoever. If you are waiting for thirst to tell you when to drink, you are consistently operating in a state of mild dehydration without knowing it. The signal that was designed to protect you has become unreliable. A practical target for most adults is approximately 30 milliliters of fluid per kilogram of body weight per day, from all sources including water, herbal teas, soups, and water-rich fruits and vegetables. This is not a suggestion to drink excessive amounts. It is a suggestion to drink consistently and intentionally rather than reactively. Start every single morning with 1 or 2 glasses of plain warm water before anything else. Before coffee, before breakfast, before your morning medications. Warm water first thing in the morning begins the rehydration process after the overnight fasting period, activates the digestive system, and immediately begins thinning and loosening the mucus that has accumulated in the throat overnight. This habit costs nothing. It requires no product, no prescription, no special equipment, and many patients report it as one of the single most noticeable improvements they experience. Not because warm water is miraculous, but because consistent morning rehydration addresses a deficit that has been silently worsening your symptoms every single day. What does not work, and why? Before I give you the complete practical plan, I want to address several common remedies that unfortunately do not produce the results people hope for, because understanding why they fall short helps you stop wasting time on them. Sugar with lemon is one of the most popular home remedies for throat discomfort, but sugar is actually a dehydrating agent that draws moisture from throat tissues, potentially making mucus thicker rather than thinner. You are treating a symptom with something that worsens one of the underlying mechanisms simultaneously. Honey has genuine soothing properties and can calm irritated throat tissue meaningfully, but it does not address any of the 4 causes I have described today. It makes the discomfort more bearable while the cause continues operating underneath. Dairy products are often blamed for creating mucus, and this claim is largely a myth. Dairy does not generate mucus from nothing. However, in some people, the specific proteins in milk can create a sensation of increased thickness in existing mucus, particularly if there is any underlying sensitivity. If you notice dairy consistently correlates with worsened throat symptoms, it is worth reducing it temporarily for 2 to 3 weeks to observe whether there is a meaningful difference, not because dairy causes mucus, but because in some individuals it changes the perceived consistency of mucus that is already present. Your complete practical plan, starting today. Let me bring everything together into a clear, actionable sequence. Tonight, stop eating at least 3 hours before you go to bed. Place a simple wedge under the legs of the headboard to gently elevate the head of your bed. Drink a full glass of warm water before sleep. Tomorrow morning, begin your day with 1 to 2 glasses of warm water before anything else enters your body, before coffee, before food, before medications. This week, purchase a simple nasal rinsing device from your pharmacy. They are inexpensive and widely available. Begin daily warm saline nasal rinsing, morning and evening, using boiled and cooled water with a small amount of salt and a pinch of bicarbonate of soda. Make an appointment with your doctor to review your current medication list, specifically in relation to your throat symptoms. Ask directly whether any of your current medications are known to affect mucus production or to promote acid reaching the throat. Come to that appointment informed. You now have the language and the knowledge to have that conversation productively. Every day going forward, hydrate consistently and intentionally. Do not wait for thirst. Minimize exposure to the environmental irritants I described wherever that is within your control, and maintain the 3-hour eating window before bed as a permanent habit rather than a temporary experiment. Your throat has been trying to tell you something for a long time. That persistent mucus is not an unavoidable feature of aging. It is a signal from your body to you that something in your environment, your diet timing, your sleep position, your hydration, or your medications deserves attention and deserves a proper response. For too long, that signal has been dismissed, misattributed to age, left unaddressed while the actual causes continued operating day after day and night after night. You now have the information to respond to that signal intelligently, not to manage the symptom indefinitely, to address the cause. In my next video, I am going to talk about 5 specific foods that research suggests may actively support throat health and help reduce airway inflammation naturally for adults over 60. You will not want to miss that one. So please make sure you are subscribed and have your notification bell turned on. If this video gave you something genuinely valuable today, please share it with someone you care about who has been dealing with the same persistent throat clearing and has been told it is simply their age. That share could make a real difference for them, and it costs you nothing. And drop a comment below right now. Tell me your age, how long you have been dealing with this, and which of these 4 causes you suspect may be most relevant to your situation. I will be reading every single response. Remember, this video is for informational and educational purposes only. Always consult with your personal doctor before making any changes to your health routine. See you in the next video.